There is a seed that has been used for thousands of years, and modern researchers are now discovering it contains compounds that directly support the one process your neurologist never told you about. If you've been dealing with burning in your feet, numbness that won't go away, that electric shock sensation that wakes you up at 3 in the morning, I need you to stop what you're doing and watch this video all the way through, because what I'm about to show you isn't a shortcut. It isn't a trick. It's a window into what is actually happening inside your nervous system, and why so many people over 60 have been suffering completely unnecessarily for years. In my decades working with patients over 60, I have watched this condition quietly steal people's lives. Not dramatically, slowly, a little more numbness each month, a little more difficulty walking, a little more fear of falling, until the person who used to dance, who used to walk in the park every morning, who used to play on the floor with their grandchildren, is now holding the wall just to get to the bathroom at night. That is not aging. That is nerve damage, and it is not inevitable. Now, about this ancient seed. I want to start here because you may have heard about it, you may have even tried it, and I want to be honest with you about what it does and what it doesn't do. The seed I'm referring to is flaxseed, known in ancient Egypt, used in Ayurvedic medicine for millennia, and recently the subject of serious clinical research into nerve health. What makes flaxseed biologically interesting for people with neuropathy is its combination of alpha-linolenic acid and omega-3 fatty acid, and lignans, which are plant compounds with potent anti-inflammatory properties. Here's why that matters. Inflammation is one of the primary drivers of nerve damage. Not the acute inflammation you feel when you sprain your ankle. I'm talking about something called chronic low-grade neural inflammation, a slow, silent process where the body's own immune response begins to damage the delicate insulation around your nerve fibers. Flaxseed's compounds can dampen that process. Researchers have observed measurable reductions in key inflammatory markers in adults who consumed flaxseed consistently over 12 weeks. So yes, if flaxseed has helped you feel some relief, there's a real biological reason for that. But here's what I need you to understand. Flaxseed is addressing one layer of a problem that has multiple layers. And if we stop there, the other layers keep working against you every single night. Let me explain what's really happening, because most doctors will never take the time to explain this in a 10-minute appointment. Your peripheral nerves, the ones that run from your spinal cord down through your legs, your feet, your hands and fingers, are not just wires. They are living tissue. And like all living tissue, they require specific nutrients to function and to repair themselves. Each nerve fiber is wrapped in a protective sheath called myelin. Think of myelin the way you'd think of the rubber coating around an electrical cable. When that coating is intact, the electrical signal travels cleanly and correctly. When it deteriorates, when the rubber starts cracking and peeling, the signal leaks, it distorts, it misfires. That is the burning you feel. That is the tingling. That is the electric shock that comes from nowhere. That is the numbness that doesn't go away. And here is what makes this especially serious for people over 60. The production of myelin depends almost entirely on a handful of very specific nutrients. Nutrients that become increasingly difficult to absorb as we age. And in many cases, nutrients that common medications are actively depleting from your body. The research on this is clear, but it rarely reaches the people who need it most. Studies suggest that up to 40% of adults over 60 are significantly deficient in vitamin B12. That number is staggering. And what most people don't know is that B12 is the single most critical nutrient for myelin production. Without adequate B12, the nervous system literally cannot maintain the protective sheath around your nerve fibers. The deterioration that follows is measurable, progressive, and, if caught in time, partially reversible. But here's the open loop I want you to stay with, because there's something about how B12 works, and specifically which form of B12 actually reaches nerve tissue, that changes everything about how you approach this. I'll get to that in just a moment. First, I want you to sit with something, because I need you to understand the full picture before we talk about solutions. Think about the last 6 months. Has the burning in your feet gotten better or worse? Has the numbness stayed the same, or has it slowly crept further up your foot, maybe into your lower leg? This is not a stable condition. In the people I've worked with over the years who did not address the underlying mechanisms, not the symptoms, the mechanisms, The progression followed a predictable pattern. First comes the burning and tingling, then comes the increasing numbness, then comes the loss of balance, the stumbles, the catches on the edge of the rug, the moments where you reach for the wall, then comes the fall. Approximately 30% of people over 65 fall each year, and neuropathy is one of the single largest contributing factors. Falls in older adults lead to hip fractures. Hip fractures in people over 70 are associated with a one-year mortality rate of up to 25%. I am not telling you this to frighten you. I am telling you this because the stakes are real, and you deserve to know them. I've seen patients who ignored these symptoms for years because their doctor said it was normal for their age. I watched a 71-year-old man, active, proud, completely independent, go from mild foot tingling to needing a walker in 3 years. Not because nothing could be done, because he was told it was just part of getting older. It is not just part of getting older. And the frustration I feel about that, the frustration you probably feel right now, is exactly why I keep making these videos. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week. Information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing, and it could be one of the most important health decisions you make today. Now, let's talk about what the research is actually showing us. Remember that question I left open about which form of B12 reaches nerve tissue? This is where most people make a critical mistake. And it's not their fault, because the supplement industry has buried the answer. There are multiple forms of B12 available as supplements. The cheapest and most common is called cyanocobalamin. It's in almost every generic B-complex vitamin on the shelf. And here's what you need to know. Cyanocobalamin must be converted by the body into its active form before it can be used in nerve tissue. In young, healthy adults with optimal liver function, that conversion works reasonably well. In adults over 60, especially those taking metformin for blood sugar, or with any degree of kidney impairment, that conversion is severely compromised. The form that actually crosses into nerve tissue directly is called methylcobalamin. This is the methylated form of B12. It does not require conversion. It enters the nervous system directly, and the research on this distinction is not subtle. Studies published in peer-reviewed journals have found that methylcobalamin supports myelin synthesis and nerve regeneration in ways that cyanocobalamin simply cannot replicate. Researchers have observed that methylcobalamin can actually support the regrowth of damaged axons, the long thread-like projections of nerve cells that carry signals through your body. This is not a marketing claim. This is what the published literature shows, and it's why I never recommend standard B12 supplements to my patients with neuropathy. The form matters enormously, and this is where the research gets really surprising, because B12, even in the right form, is only part of what's missing. The second compound that the research increasingly points to is alpha-lipoic acid, not to be confused with the alpha-linolenic acid in flaxseed. This is a different molecule entirely. Alpha-lipoic acid is a specialized antioxidant. What makes it unique is that it is both fat-soluble and water-soluble, which means it can enter every part of a cell, including the mitochondria, which standard antioxidants like vitamin C cannot reach. Why does this matter for your nerves? Because oxidative damage inside nerve cell mitochondria is one of the primary mechanisms by which chronic neuropathy progresses. The mitochondria of a nerve cell in a person with long-standing neuropathy are under enormous oxidative stress. Alpha-lipoic acid works directly inside those mitochondria to neutralize that damage. What the clinical evidence shows, and this has been studied extensively in European settings for decades, is that alpha-lipoic acid can measurably reduce burning sensation, tingling, and nerve pain. One of the most widely cited reviews in the field analyzed multiple clinical trials and found consistent evidence of symptomatic improvement with supplementation. And if this goes unaddressed for years, those mitochondria don't recover. The damage compounds. I had a patient, I'll call her Margaret, 69 years old, retired school teacher. She came to me after 2 years of what she described as walking on hot coals. Her podiatrist told her it was plantar fasciitis. Her internist prescribed gabapentin. The gabapentin made her so dizzy she was afraid to drive. She stopped it after 4 months. The burning continued. When I looked at her complete picture, her B12 levels, her inflammatory markers, her history with a blood sugar medication she'd been on for 8 years, the pattern was unmistakable. She was severely deficient in methylcobalamin. She had measurable signs of oxidative neural stress, and the medication she was taking for blood sugar had been documented in the literature to reduce B12 absorption by up to 30% in long-term users. Within 4 months of addressing those specific deficiencies with the right compounds in the right forms, Margaret told me that for the first time in 2 years, she had slept through the night. Not because the nerve damage reversed overnight, but because the biological environment that was driving the damage had begun to shift. I want you to sit with that for a moment, because Margaret's story is not unusual in my practice. It is the norm, and the tragedy is not her suffering. The tragedy is the 2 years she spent suffering unnecessarily while being told this was normal. This is not just about the burning. I want to be very clear about that. What neuropathy does to a person's life goes far beyond the physical sensation. It disrupts sleep. Night after night of burning and cramping that pulls you out of a deep rest. This doesn't just make you tired. It dismantles your immune system. It elevates stress hormones. It accelerates cognitive decline. The research connecting chronic sleep disruption to brain health is not ambiguous. It isolates you. I've watched patients stop going to family dinners because they're afraid of walking on unfamiliar floors. Stop going to church because the parking lot is uneven. Stop visiting grandchildren because they can't get down on the floor and they're afraid of what will happen if they do. It erodes your sense of self. The person who used to be capable, independent, active, begins to see themselves as fragile, as a burden. That word, burden, comes up more times than I can count in these conversations. No one should have to feel like a burden in their own family because of a condition that has biological solutions. And the anxiety, the hypervigilance, every step on a new surface calculated, every staircase assessed, living inside a body you've stopped trusting. That is an exhausting and devastating way to spend your years. The link in the description below takes you directly to the natural nerve support formula I recommend to my patients. It combines everything I've covered today in the specific forms that actually reach nerve tissue. Take a look when you have a moment. I think it will make a lot of sense after what you just learned. Let me walk you through the other compounds that the research supports, because the picture is incomplete without them. Acetyl L-carnitine is an amino acid compound that supports energy production inside nerve cells. Think of it as fuel delivery. A damaged nerve cell that lacks the energy substrate to begin rebuilding is like a construction crew that showed up to the job site with no materials. Acetyl L-carnitine helps get those materials into the cell. Clinical studies have examined its role in peripheral nerve support, and the evidence points to meaningful improvements in sensation and nerve function over time. What makes acetyl L-carnitine particularly important is that it works at the cellular energy level, not just as an antioxidant, but as an active participant in the regeneration process. Benfotiamine is the fat-soluble form of vitamin B1. I want to be careful here because most people have heard of thiamine, standard B1, and may have tried it with limited results. Benfotiamine is not the same thing. Its fat-soluble structure allows it to penetrate nerve tissue at concentrations that standard thiamine cannot achieve. It has been studied specifically for its role in protecting nerves from glucose-related damage, which is critical for anyone with diabetes or prediabetes. Elevated blood glucose damages the tiny blood vessels that supply nutrients to your peripheral nerves. Benfotiamine interrupts that process. European clinical research on this compound spans decades, and the findings are consistent. Magnesium rounds out the picture in a way that most people overlook. Magnesium is involved in over 300 biological processes. One of its most critical functions is the regulation of calcium channels in nerve cells. When magnesium is deficient, and research suggests that up to 80% of Americans are suboptimal in magnesium, nerve cells become hyperexcitable. The threshold for firing drops. Small stimuli produce exaggerated responses. That is a direct contributor to the hypersensitivity, the cramping, and the shock-like sensations that many people with neuropathy experience. Now, finding each of these compounds separately, in the right forms, the right doses, and the right combinations, is not easy, and most people over 60 don't have the time or the knowledge to put this together on their own. That's why I've left a link in the description to a formula that brings all of this together. I've reviewed it carefully, and it's one of the few options I feel comfortable recommending to my patients. I want to take a moment to address something that I know many of you are thinking. If this information is real, if the research exists, if these compounds have been studied for decades, then why hasn't your doctor told you any of this? This isn't a conspiracy, it's a system problem. Medical education focuses almost entirely on pharmaceutical intervention. A physician in a 10-minute appointment is trained to diagnose and prescribe. They are not trained in nutrient deficiency as a driver of chronic neurological disease. The research on methylcobalamin and alpha-lipoic acid exists in academic journals, but it doesn't translate into clinical practice protocols. It doesn't get discussed in continuing medical education funded by pharmaceutical companies. And the result is that millions of people over 60 are managing symptoms with drugs that carry significant side effects: gabapentin, Lyrica, various opioids, while the underlying nutritional deficiencies continue unchecked. This is not your doctor's fault. They are working within a system, but you are not required to be limited by that system. You can take this information, you can act on it, and you can change the trajectory of what happens next. And the next time you reach for that flaxseed, or whatever has been giving you some temporary relief, I want you to remember what you learned today, because now you understand that flaxseed is addressing one layer of a multi-layered problem. Inflammation. It touches inflammation. And that is genuinely meaningful. But the myelin is also waiting for methylcobalamin. The mitochondria are waiting for alpha-lipoic acid. The nerve cell energy systems are waiting for acetyl L-carnitine. The calcium channels are waiting for magnesium. Your nervous system has a remarkable capacity to begin responding when given the specific support it has been lacking. I have watched it happen in patients who had been suffering for years. The body is not passive in this. It is trying to repair. It has been trying to repair. It just hasn't had what it needs. You are not powerless here. You have never been powerless here. You simply hadn't been given the right information until today. If today's video opened your eyes to something important, share it with someone you care about, because there are millions of people over 60 dealing with this silently, and they don't have to. The link in the description goes directly to the natural formula I recommend. Take a look when you have a quiet moment. Subscribe for more critical health information every week, and leave a comment below. What was the most surprising thing you learned today? I read every single one.